The local NHS organisations, which pay for local health services, decide what we get and, more importantly, what we don't get, because they hold the purse strings. We all know how tough it must be when the NHS is short of money to choose between, say, elderly dementia beds and children's cancer beds. So you'd hope that the really difficult decisions they have to make are based on evidence, or at least on common sense. Not so in North Norfolk and Norwich care commissioning groups. These two CCGs say they haven't commissioned a diagnostic service for adults who may have an autism spectrum disorder, an ASD, because, and I quote, there is an expectation that anyone with ASD be identified in childhood. Now, let's just think about this for a minute. Anyone with autism, and that would include Asperger's, will have been identified in childhood. So what went wrong in my case? I was only diagnosed 4 years ago, when I was 57. And what went wrong in all the other cases that you learn about from personal stories on social media or news stories on the telly, or all the cases cited in medical research papers? Maybe they're all fake news. So, let's just hang on a minute. I was born in 1957. North Norfolk CCG and Norwich CCG expect me to have been diagnosed when I was a child. Okay, so that would have to have been before 1975, which is when I became a grown-up. But just listen up to NICE, the National Institute for Health and Care Excellence, which knows about these things. And I'm quoting them directly. Autism was not included in psychiatric classification systems until 1980, and the diagnostic criteria for Asperger's syndrome were only established in 1994. Now, NICE is not an organisation to be trifled with. If in the medical world they say jump, you say how high. So, medicine in the UK didn't recognise autism until 1980, but Norwich and North Norfolk CCGs expect me to have been diagnosed before 1975. And I was 37 before they got around to defining Asperger's. How could I possibly have been diagnosed when I was a child? How could anyone who was born before 1976 possibly have been diagnosed with Asperger's when they were a child? And stay with me, because it gets still worse. Just because the great and the good produce a clinical definition of a disorder, it doesn't mean the NHS sets up services nationwide to handle it. You don't instantly get experts everywhere who can spot the signs of a particular disorder. They take years to develop their expertise. And you certainly don't get all the rest of the paraphernalia you need to actually start carrying out diagnoses. The nurses and admin staff, consulting rooms and tests, not for years, decades sometimes. But Norwich and Norfolk CCGs expect anyone with autism to be identified in childhood. So, what of the children who were diagnosed in the 80s and 90s? When the diagnostic services were few and far between, underfunded and short-staffed. They were generally the children whose autism was so obvious even the uninitiated could see there was a problem. And what about the rest of us? The ones with, horrible term, high-functioning autism. And more particularly, what about the girls and women with high-functioning autism? We're the ones who, it turns out, are very adept at disguise. Throughout our childhoods and right on into our adult years, we masked our autism traits as we struggled to fit in. Now, we've always had Asperger's. We just passed for normal for decades. It's only now that we're getting our diagnoses. But not in North Norfolk or Norwich, obviously. I was lucky. I was living in the northeast when I was referred to an adult autism team. If I'd been living in Norwich, or Holt, or Cromer, or any of the other towns in North Norfolk, I'd still just be an ordinary, screwed up, undiagnosed, miserable, snotty old woman. all the women who live in Norfolk, and all the men too, who have Asperger's and need help but haven't got a diagnosis yet, they don't exist. Not according to North Norfolk CCG or Norwich CCG. Well, they do exist. And around 2,000 of them are living in Norwich and North Norfolk, and they're being denied access to a diagnosis and health and social care because of, what do you call it? Nonsense? Rubbish? Claptrap? Whatever you call it, these people are being discriminated against.